is Dr. Anna Aronson. I'm an ENT physician with the ENT and Allergy Associates, and I practice in the Wall Street office. Today we're going to talk about nasal congestion and what we can do about it. When you come to the ENT doctor, one of the first things they ask you about your nasal congestion is how long it lasts. And is it one-sided, both-sided, does it change sides? Those are the things that will help the doctor figure out what causes your congestion and how to treat it. So let's address that. First, if your congestion lasts only for a couple of days, it usually can be due to either a cold or a beginning of allergies. Cold, obviously, will be accompanied by sometimes a sore throat, runny nose, sensation of not feeling well. Occasionally you may have a low-grade fever. Cold symptoms can be treated with over-the-counter medications. You can try a decongestant nasal spray like Afrin. Just make sure never to use it more than 3 days, as Afrin can cause rebound congestion when your nose will feel more congested if you use it for prolonged periods of time. You can also use oral decongestants like Sudafed. However, once again, make sure you don't have any conditions that are contraindicated with use of Sudafed, like high blood pressure. You can use medications like Mucinex to loosen up secretions if they're really thick, and also medicines like Advil, Tylenol to bring down the fever or help you with the sore throat. If the cold symptoms persist more than a week or two, then the cold may have turned to a sinus infection. In that situation, you may have pressure in your face, the mucus may become thick or green or yellow. Some sinus infections may resolve with over-the-counter treatments, but after a few weeks, if it doesn't, consider seeing a doctor. You may need to take antibiotics. Sometimes short-lived symptoms for a few days may be a sign of beginning of allergies, especially if they happen during certain seasons like spring or fall. Most people know if they have allergies, but you can develop at any point in your life. You don't have to be born with it. Just like any other conditions, allergies can occur at any age. So you can also try over-the-counter medications. We usually recommend using a decongestant nasal spray like Flonase or Nasacort, and oral antihistamines like Claritin, Allegra, Zyrtec, or Zyzal. Just be aware most allergy medications take a couple of weeks to relieve your symptoms. So if you don't feel better after a couple of days, it doesn't mean the medicine is not working. It may be not long enough, or you may have a condition other than allergies. Once again, if it lasts more than a couple of weeks and is not relieved by medications, consider seeing a doctor. If your symptoms are lasting several weeks to months, that is more likely to be more of a chronic condition. Again, could be still allergies, and the treatment is the same as we discussed, or your allergies may progress to what's called chronic sinusitis, where inflammation in the sinuses can become more permanent. In that situation, you also should see an ENT doctor who can help you manage it, and sometimes we'll get a CAT scan, which is like an X-ray of your sinuses, to see if it's truly chronic sinusitis that may require surgical intervention. Very rarely in adults, but commonly in children, blockage in the nose can be due to a tissue called adenoid. Adenoid tissue is like your tonsils, and it can be large in children, but as we grow, it gets smaller. But sometimes adults can also have large adenoid. Occasionally from frequent infection or sore throats. Patients with HIV sometimes have large adenoid, or sometimes people can get bad things like lymphoma in the adenoid itself. Again, that should be seen, diagnosed, and treated by an ENT physician. The doctor may do what's called a nasal endoscopy, where the doctor puts a long noodle inside your nose to see what the tissue looks like and it requires further intervention. Sometimes chronic congestion can also be due to things like polyps. Polyps are swellings in the lining of the nose, most commonly due to allergies. Again, those probably will not respond to simply over-the-counter medicines and should be treated by a physician. Very rarely, bad things can occur in the nose, like cancer or precancerous growth. The signs that should be evaluated by a doctor would be that if your congestion is always one-sided. For example, if you've always been fine, you had no trouble breathing through your nose, but a month or two ago you started having trouble breathing through the right side, and it's always the right side that's stuffy, those symptoms should bring you to the doctor. It doesn't mean there's something bad going on. Sometimes it can be due to a combination of severely deviated septum and allergies, but occasionally one-sided blockage can be due to something sinister. So if your nose has been stuffy only on one side, always the same side, and for more than a few weeks, consider seeing a doctor to help you address that issue. Call us today, see us today.